lots of reasons for men to want and women to want hair transplant surgery. Many of those have to do with self-esteem. When you look in the mirror and you look old, you feel old. And I know for myself that I'd passed that 40-year-old mark and I was losing my hair. I looked in the mirror. It was hard for me to get motivated each day. I felt old. I see that same thing with many of my patients. A lot of the women that I transplant, oftentimes they're always trying to style their hair just right. They're afraid to go out in the wind. They're afraid to get in the swimming pool, those kind of things. When they get their hair back, they no longer have to worry about those things. They don't have to worry about that self-esteem. Hair transplant surgery has truly progressed amazingly over the last few years. And as I mentioned earlier, it takes time for hair to grow. So as we did our initial surgeries years ago, it took a year for those hairs to grow in and figure out what was working, what wasn't working. It wasn't too long ago when we were doing plugs, which was large groupings of hair. And as long as you had hair surrounding those plugs, it didn't look too bad. However, now as people have lost the surrounding hair, those plugs don't look so natural. We're able to do individual follicular unit transplantation now, or microscopic types of surgery, where each hair is transplanted and placed individually in a very natural and normal pattern. And truly, you can't tell when somebody's had a transplant. Hair transplant surgery is relatively safe. It is done under local anesthesia. With any type of surgery, there are always a certain number of possible problems, but in my experience and with the thousands of patients that I've transplanted, those are extremely rare, and as long as we are aware of those and prepare for those, that's really not a problem. It's a very pleasant day for the patient. You come in the morning after a nice breakfast, a good night's sleep. Halfway through the day, we provide a lunch for you. You're able to relax, watch movies, read a book, listen to music while we do our work. So it is a relatively painless procedure. It is a relatively enjoyable day for the patient, as well as being able to receive your hair and knowing that in the future you're going to have a more youthful appearance. There are several recommendations as far as preparing for the surgery. We recommend that you don't do heavy exercise or take products that can promote bleeding. Because the scalp is a very vascular area, we don't want to have a lot of extra blood to have to deal with. So if you can avoid aspirin products, heavy exercise, vitamin E, those types of things that are going to promote bleeding, if you can avoid those in those days preceding surgery, that is definitely helpful for you. In the days following surgery, you're looking at about 3 to 5 days where there will be some redness where we've done the surgery and those new hairs are settling in. Up to 10 days for most people, you'll notice a faint redness and then it will just slowly go away. After about 2 weeks, for most people, you can't tell that you've even had the surgery, other than there will be a slight donor scar in the back, which is just very, very fine, and your existing hair will cover that completely. We also recommend that you don't do heavy exercise, that you limit those types of activities for a week following the procedure as well. We advise you to stay out of direct sunlight for your scalp for a period of a few months so that you don't get sun exposure or burning to the scalp as well. But otherwise, most people can go back to work within a day or two. For those that don't have any hair at all, there is that redness, and you may have to wait a little bit longer to keep that out of the public eye, but if that doesn't bother you, you can go back to work the next day.